Now, former White House advisor for health policy under President Obama, Dr. Ezekiel Emanuel. He's vice provost of global initiatives at the University of Pennsylvania. In his latest op-ed in the New York Times is entitled, "The Coronavirus is Here to Stay. So what happens next?" Dr. Emanuel, good to see you. I want to get to that big picture, 30,000-foot view of where things are and where they're headed. But want to ask you specifically as a medical doctor about the implications of this lack of supply in hospitals, this lack of masks and gloves and gowns. What does that mean exactly for the future of this outbreak?
So let me tell you, I got contacted by a emergency room doctor I know in Denver. And he was telling me that I asked him what the situation is. He says they don't have enough protective equipment. And he described to me how a woman came in who needed to be intubated. There was no mask, no gown, but he just intubated her. Well, if she has coronavirus, the chance that he gets coronavirus is going to be very high. These are exactly the kind of situations, going to the back of the throat, going into the lungs with a tube and a clamp. It's a problem, and it'll knock out a lot of people. As has been pointed out by some people, about 9% of the people in Italy who've gotten infected have been healthcare workers. You knock out a healthcare worker, they're out for at least 14, maybe 21, 28 days. They're not doing their job, and we don't have an excess supply. So just take respiratory therapists who handle those ventilators we're all talking about. There are only about 76,000 in this country. They got to, staff a hospital for 3 shifts. Each one can overlook, 4, 5, 6 ventilators. You don't have a lot of excess capacity to care for all the patients in the country. And, if we don't have enough stuff, we don't have enough people, and we don't have enough beds, we're going to have a serious problem in this country.
So what do you see as a policy matter changing that trajectory? Because right now it's slow to get any of that equipment. They're talking about retrofitting shuttered automobile plants in the state of Michigan to make ventilators. That's going to take a lot of time, a noble effort, but it will take time. How do we stop what you're discussing right now, what you're explaining could happen very soon? How do we stop that from happening?
So there are 2 things. First, we obviously need to ramp up production. And we're talking huge wartime production. Just the mask, it's estimated we need 3.5 billion masks in the country. I talked to Elon Musk yesterday about making ventilators. He thinks it's something like 8 to 10 weeks before his plant can get online. But it's in our hands, as Mika said. Social distancing, staying away from people, staying away from droplets, that is going to be the key here to try to damp down the number of people who get coronavirus, the number of people who need hospitalization, and the number of people who need ventilators, ICU care, and doctor care. And unless we damp down those numbers, we are going to have some serious problems. What I see is that some states are serious. Ohio under Mike DeWine, a Republican governor, California, Washington under Jay Inslee, New York, and many other states. And then you've got states like Florida that are still partying as if it were normal times. This just makes no sense.
So, Doctor, it's Jonathan Lemire. Let me follow up on that exact point. What sort of guidelines do you think average Americans should be following in terms of their behavior, in terms of social distancing? And those who are just sort of, coming to grips with this, their life has changed so dramatically in this last week or 10 days as they're staying indoors, they're not going to work, their children aren't going to school. How long should we all anticipate that happening? And what are some extreme cases as to how long this could have to last?
Well, let's deal with, if you look at China, when they closed down Hubei province, from that moment to when it really came down, looked to be about 8 to 12 weeks. So I think that's what we are looking at for the next social distancing episode, 8 to 12 weeks. That's 3 months, basically, for people. So April, May, June. We're talking somewhere in, May 15th to July 1st. We're going to then hopefully be able to ease up on these social restrictions, but we've got to be very clear about it. The virus is going to come back. It's not like it's going away. And then, so we're going to have this roller coaster of social restrictions. Then we're going to have easing up, social restrictions easing up to try to smooth out the demand on the healthcare system. And look, it's a very big imposition on everyone. I will tell you, I'm a guy who likes to throw dinner parties. We can't eat dinner with anyone else. And this is, I find that very problematic, not talking to friends. And this is just a serious, serious change in our life. But it is a matter of vital importance if we want to save people. That Imperial College estimate that if we don't do this, 2.2 million people die. Let me put that in context for your viewers. 2.7 million people die every year. That's like doubling the total death rate in the United States. I don't think that's acceptable. It's a horrible idea.
And we're starting to hear more of these individual stories, Zeke. While any outbreak has its share of harrowing stories, they sort of help illustrate how real the consequences of this pandemic has become and how important that very difficult social distancing has become. It's not just the elderly. It's not just a rare occurrence. Here are just three. Hartford, Connecticut. 4 Hartford police officers are recovering after testing positive. How many more cops in Hartford have it? Just an example of how law enforcement is feeling the strain as they take on additional roles at critical times during this outbreak. Consider that many local police forces are now having to conduct wellness checks for children now stuck at home alone while their parents are at work. In New Jersey, a single family has lost 4 members to the coronavirus. 4 from one family. 19 other members of that family, that same family, from spouses to children, have been tested and are now under quarantine. In California, a 34-year-old man who tested positive for the coronavirus after visiting Disney World and traveling through Los Angeles International Airport. He was at Disney World in Florida as well as Universal.
Yep.
He died yesterday at a hospital in Pasadena. On March 7th, the man developed a cough. Less than 2 weeks later, he was dead. Zeke, these stories are getting closer to us. People were crammed in Disney World in Florida just last week.
Yeah, so first of all, that case illustrates young people can get it and they can have very bad symptoms. While the death rate may be low, 0.2% is what we're estimating based on Chinese data, that doesn't mean it's zero, and that does mean that some people will unfortunately die from this. And we, most of us are feeling well, but we have to realize, feeling well does not mean you're not infected or you can't become infected. And there can be, as you point out, dire circumstances if we don't take this seriously. And just because young people feel invincible doesn't mean they are invincible. And partying in Florida with all those older people around, that is a recipe for all of Florida becoming one of those cruise ships.
Gene Robinson.
Zeke, this is Gene Robinson. Does anybody have any idea what the factors are that sort of determine who gets very sick from this virus and who walks around with the virus totally asymptomatic? It seems to have, I know that age, obviously, and respiratory conditions are a factor, but it seems, you have the example of the 34-year-old person who died. There are a lot of 34-year-olds, presumably, who are walking around with the coronavirus. Is there some component, something about people that makes them more vulnerable? Do we know anything about that yet?
We don't know anything about that. So, there are 2 factors, and I think, Gene, you've identified one of them. Is there something, maybe a particular gene that certain people have that makes them more susceptible? We don't know. People are working on that right now. I know people at the University of Pennsylvania, this is a top priority. The other question is somehow the virus, as it moved from China to Italy to Iran, now to the United States, getting more virulent and more lethal? And that is something you can't rule out. These viruses do mutate. While they often mutate to become easier and therefore not as big a problem, they can mutate to become more lethal. And that would be a serious, serious, worrisome problem to everyone.
All right, Dr. Zeke Emanuel, thank you so much for all your guidance through this. And we want to mention your new book, The $1 Trillion Revolution, How the Affordable Care Act Transformed Politics, Law, and Healthcare in America. And Gene Robinson will be reading your piece about how to stay together when you can't be together. Up next, actors got tested, so did politicians and athletes. The well-connected have found easy access to coronavirus tests, while other Americans, including frontline healthcare workers, have been shut out. We'll talk to the Washington Post reporter who's digging into that. Plus, before the virus spread nationwide, Washington state was ground zero. Hospitals there are still sounding the alarm, all but begging for badly needed supplies. We'll get an update on the struggle to treat patients and protect workers next on Morning Joe.
Thanks for checking out MSNBC on YouTube, and make sure you subscribe to stay up to date on the day's biggest stories. And you can click on any of the videos around us to watch more from Morning Joe and MSNBC. Thanks so much for watching.